Hello and welcome to Community Health Choices Information Meeting. My name's Brad Levan and I'm a Senior Project Manager for Aging Well PA. Today we're going to go over some basic information concerning community health choices. I know many of you may have questions. I encourage you to write your questions down as we go through the presentation. This way we'll make sure that you don't forget anything that you want to ask. The goals for today are to introduce you to Community Health Choices program. We'll talk about the reasons it's being implemented, and we'll discuss how you can benefit from the program. I'll also talk about changes to your services and supports. We'll take a look at how you can enroll in the program. We'll spend a little bit of time talking about the LIFE program, which is an alternative option, and what you'll need to do. Community Health Choices is also known as CHC, which is a whole lot quicker to say, and it's for older Pennsylvanians and adults with disabilities. It's primarily designed to help people remain in their homes and increase their quality of life while doing so. The program goals for Community Health Choices, or CHC, are to enhance opportunities for community-based services. When we talk about enhanced opportunities, we're talking about better opportunities and perhaps more opportunities. Another goal is to strengthen the coordination of healthcare and long-term services and supports. Oftentimes these two delivery systems work side by side, but they don't necessarily coordinate well. CHC will also allow for new innovations, new ways of doing things. It will promote the health, safety, and well-being of anybody who's enrolled. One of the other goals is to ensure transparency, accountability, and effectiveness. With a program this big, you want to make sure that it works and that it works well. Okay, let's take a look at who is eligible to be part of Community Health Choices. Who can enroll? Well, if you're over 21 years of age and are eligible for both Medicare and Medicaid, and by the way, if you're not sure if you have either or both of these, take a look at the two cards on the slide. If you have both of these cards, then you have both Medicare and Medicaid. People who are currently living in a nursing facility paid for by Medicaid or have qualified for Medicaid long-term services and supports because you need the level of care typically provided by a nursing facility, but you're still living in the community. Well, you're eligible as well. The term NFCE, or Nursing Facility Clinically Eligible, means that you need a level of care that's equal to one that one would need in a skilled nursing facility setting. Let's take a look at some of the people who are not eligible for Community Health Choices. People who are not enrolled in Medicaid are not eligible. Those who receive long-term services and supports in the OBRA waiver. And if you're in the OBRA waiver, you probably know that already. But these are people with a developmental physical disability, but who would not be eligible for nursing home level care. If you're under the age of 21, you're not eligible. Someone with an intellectual or developmental disability getting services through the Department of Human Services Office of Developmental Programs would not be eligible. Or if you're a resident in a state-operated nursing facility, by the way, this includes state veterans home, you would not be eligible. I want to switch our focus for just a minute and talk about managed care organizations. Community Health Choices is different from the current system used in Pennsylvania. With Community Health Choices, managed care organizations will be used to coordinate the physical and long-term services and support. A typical managed care organization is one that receives a set amount of dollars to provide all the services and care someone might need within a specific time period. There are currently 3 managed care organizations in Pennsylvania. They are AmeriHealth Caritas, PA Health and  and UPMC Community Health Choices. You'll be learning more about these three MCOs, or managed care organizations. They'll have information sent to you in the mail. Many of you may have already received some of this information. Everyone eligible for Community Health Choices will be asked to select one of these three as your managed care organization. You can learn more about each of these managed care organizations by visiting their websites, which are listed on this slide. You might want to take a few seconds to write down these web addresses. That way it will be easier for you or someone else to take a look at the kinds of programs and services each of the managed care organizations provide. At this point, some of you might be asking, why make the change? Aren't there already programs that provide health care and long-term services and supports? And the answer is yes, there are. But many people may not know of all the services that exist, so they might miss out on something that could be helpful to them. Other people tend not to be good planners. They might only look for information about what might be useful to them when they're in a crisis, and oftentimes that's a little bit too far down the line. Under today's current system, if somebody needs assistance, it can be a challenge to figure out how to deal with the multiple programs, services, and providers. There's a lot of them out there. For some, this can be very complex and confusing. It's not always easy to figure this out on your own. By using a managed care organization, it will be simpler to know what's available and to manage getting what's needed. On this slide, we have an example of what I mean by making things simpler and easier to manage. In these three photos, we have the same person. In the first photo, on the left, the man is visiting his family physician for a chronic condition he'll be dealing with for the rest of his life. In the second photo in the center, he's getting physical therapy for a specific injury that he has that has an impact on his ability to do the daily things he needs to do. And in the third photo, he's talking to his home health care worker. This means, under today's system, he needs to interact with three different organizations. Well, with Community Health Choices and through managed care organizations, he'll now only need to interact with one, the managed care organization that he chooses. With Community Health Choices, managed care organizations will be responsible for coordinating all of the services we just talked about. They'll be responsible for making sure they're the right services and that they're delivered correctly. This is what we mean by being accountable. They'll do this by measuring and monitoring how well they're doing. This way they can make improvements when needed and find better ways to serve Pennsylvanians. With Community Health Choices, each of the managed care organizations is responsible to have an adequate network of providers to meet your needs. This means they can't ignore your need because they don't have something that will work for you. At this point, you might be concerned about your current long-term services and supports. What you should know is that the managed care organization will contract with all qualified providers for the first 180 days. People can keep their current long-term services and support providers. In terms of your physical health providers, the length of time you can keep the current provider is 60 days. Remember, long-term services and supports are the services that help you do normal daily activities like bathing, dressing, and eating. So for the first 6 months, things will stay the same and give you even more time to learn about the three managed care organizations. The 180 days is called a transition period, and you might wonder what happens after the transition period. Well, after that first 180 days, the managed care organization will have contracts in place with qualified providers. And if your current provider is one of those under contract with the managed care organization that you choose, you may be able to keep your current provider. For this reason, it's probably really important for you to talk with your current provider to find out if they're working to develop contracts with managed care organizations. If your provider is not under contract, you'll be asked to choose a new provider. So it's a good idea to make a list of all your providers so that you don't miss any when you attempt to talk with them. Some of you may have a service coordinator you really like, and you're wondering if you can keep that person as your service coordinator. The answer is that you'll be able to keep your current service coordinator for that first 180 days of the transition period. But after that 180 days has passed, each managed care organization will determine how they will handle service coordination. They might choose to use existing agencies, and that might include the one that your service coordinator is with. Or they might hire their own staff. And finally, they could choose to use a combination of both internal staff and people from existing agencies. So it may be very important for you to ask if the agency providing your service coordination is one that's going to be working with a managed care organization after the transition period. If you're someone who hires and manages your own services and supports, you're part of what's commonly known as a participant-directed or employer authority model. And if you do this, you can keep your direct care workers and continue working with their financial management service just as you did before. There is another program we should spend a little time with, and that's the LIFE program. The LIFE program is a managed care program, but it's a different type of managed care. If you're over 55 years of age and you currently receive services from the Living Independence for the Elderly, or LIFE program, you may choose to enroll in Community Health Choices, or you can stay in LIFE. However, if you want to enroll in Community Health Choices, you must specifically ask to be moved to Community Health Choices. Please keep in mind, though, this is your choice. Okay, here's some additional information about LIFE programs. As we said earlier, you must be 55 years of age or older to be eligible. You must require a level of care at the skilled nursing or special rehabilitation level. You'll have to meet their financial requirements or be able to pay privately. And you must live in an area served by LIFE. And not all areas have the program. And finally, you must be able to be served safely in the community as determined by the LIFE program personnel. To find out more about the LIFE program, you can call 1-800-753-8827, or you can visit the web address presented on this slide. There are two other programs we should mention briefly. They are Act 150 and OBRA. Act 150 is the attendant care program for people with disabilities, and as we said earlier, OBRA is the program for people with developmental physical disabilities. These programs will both continue to be available, but there is one important difference. Act 150 participants eligible for Medicare and Medicaid will get their physical health benefits from the managed care organizations, and their long-term services and supports will continue to be provided through Act 150 programs. You may not be sure about your program, but you should know that everyone currently served by an eligible program will be contacted and provided with guidance and assistance. Next, we need to talk about another part of Community Health Choices. Pennsylvania uses an independent enrollment broker, also called an IEB. Their job is to help you select your managed care organization and enroll you in the one that you choose. Some of you have received your enrollment packages already. The independent enrollment broker is supposed to follow up and talk with you about your options, or you can call them with questions. The phone number and web address on all of these slides belongs to the independent enrollment broker, and you'll see them at the bottom of each slide. When you call, they will ask about current providers and your preferences. This is one reason it's a good idea to make a list of all of these before talking to them. Let's take a look at how people will enroll. Enrollment in Community Health Choices is automatic, and it begins on November 13th in the Southwest region. The reason for this is because of the large number of people that must be placed into managed care organizations. Simply put, there's over 78,000 people in this region who are dual eligible. Remember, that's Medicare and Medicaid. That's a lot of people to get assigned to a managed care organization in a very short period of time. We need to make sure everybody has a managed care organization by the first of the year. Here's what happens. If you haven't already, you'll get a letter from the Department of Human Services letting you know what the first steps are. After this comes the enrollment package from the independent enrollment broker, which, as I said earlier, some of you may already have. It's important to know that if you're placed in a managed care organization before you choose one, you have until the end of the calendar year to actually choose the one that you want, and you'll be moved to that managed care organization. Choosing a managed care organization will be different for each person. But here's an example of what an independent enrollment broker might talk about with two different people, Mr. Garcia and Mrs. Owens. Both Mr. Garcia and Mrs. Owens like their home care providers a great deal. For Mrs. Owens, her choice is easy. She wants to select the managed care organization that has her current home care provider in that network. The choice for Mr. Garcia is harder. He realizes that he needs a specialist to take care of a medical condition, and he finds out that one managed care organization with the specialist he needs doesn't have his home care provider. So Mr. Garcia has a different choice to make. He has to decide which would be better for him. The independent enrollment broker should be able to help him with this decision, and it should be able to help him figure out what the best fit is for what he thinks is the most important thing to him. I want to spend a little more time talking about enrollment dates because it can be confusing. Please remember that enrollment in CHC is automatic. That means no one will be left behind. You will, however, need to pick one of the three managed care organizations as your managed care organization. On November 13th, automatic enrollment started. As I said earlier, there are approximately 78,000 people that need to be enrolled by the end of the calendar year, so they simply have to start enrolling people to make sure everybody gets in. This does not mean that you don't have a choice. You can call and enroll, or starting November 13th, you can go online and enroll, or you can mail the form from the enrollment package. You can enroll up till the end of the year. If you haven't expressed your choice, you will be placed in a managed care organization. But remember, you can change your managed care organization anytime. Keep in mind, it takes approximately 1 month to make that change. Enrollment packages started to be mailed on October 6th. If you didn't get yours, you will soon, and they'll contain all the information you see on this slide. They're also available in the top 15 languages. Just as a reminder, the independent enrollment broker is the place to get enrollment information, and their phone number and web address are at the bottom of each slide. I'm sure some of you may be wondering if you'll lose services, and the answer is no, you may actually gain services. The managed care organizations are required to honor participants' wishes in terms of living in the least restrictive setting. People can choose to live in the community, and it's the responsibility of the managed care organization to line up the services needed to do that successfully. If you reside in a nursing home, however, on the date that CHC is implemented, you may remain there if that's your choice. There's another term we should talk about that you may hear people using, and that's continuity of care. This means that if you're in a nursing facility at the time the transition to community health choices takes place, you'll be able to stay in the medical assistance participating facility. As I said earlier, If you're already getting home and community-based waiver services, you'll be able to keep the same provider for up to 6 months. If after the start of Community Health Choices, you want to change plans, the current services at the time will continue for 60 days until the new plan starts. All of this is to make sure that there is continuity in the care that you receive. Okay, let's move on and talk about one of the advantages of Community Health Choices, and that's the Adults Benefit Package. All Community Health Choice participants will receive physical health benefits that include doctor visits, laboratory tests, and hospital stays. And for many people, an advantage of the managed care organization is the use of service coordination. Not everyone may have this now. A service coordinator will meet with people in the program, review their current services, assess their needs, strengths, goals, and preferences. These discussions can include healthcare issues, home care, and housing. And this is one example of how managed care organization can make things simpler. Service coordination gets rid of the need to work with multiple organizations and agencies on your own for things like doctor visits, laboratory tests, and hospital stays. Another part of the Adults Benefit Package is for Community Health Choice participants who are not receiving long-term services and supports. For these people, a health screening will be conducted within the first 90 days. This helps to know if additional services are needed, and it makes sure that physical health care is provided appropriately. More information about the Adults Benefit Package can be found at this web address. If you're someone that qualifies for Medicaid long-term services and supports, and remember, those services and supports are the things that allow you to perform normal daily activities of living. You may find that there are several services and activities added or expanded to what you currently have. Depending on the managed care organization you pick, there may be services and other benefits like dental or even health and wellness gift cards. For those concerned with behavioral health services, it's important to know that these services will be provided through already existing behavioral health managed care organizations. For people living in nursing facilities and aging waiver participants, this is new. It's important to know that Community Health Choices and the managed care organization will work together to coordinate all services, including behavioral health services. If an individual in Community Health Choices wants to move back into the community, the managed care organization will help with affordable and accessible housing, setting up or establishing the household, and coordination of any needed in-home services. For some participants living at home who want to return to work or start work, they can get assistance from the managed care organization in doing this. Care management plans are also part of Community Health Choices. Participants will have plans that focus on physical and behavioral services, and this can include active, chronic conditions, health services, veteran services, and Medicare and other services. A very important part of Community Health Choices is the use of person-centered plans for participants who are receiving long-term services and supports. These plans put you at the center of the planning process. Others don't plan for you, they plan with you. Now, this includes a care management plan for physical and behavioral health, a long-term services and supports plan, and a person-centered service plan that is developed together with the person-centered planning team. Keep in mind that you as a participant are a part of that team, perhaps the most important part of that team. It's very important to know that with Community Health Choices, your Medicare will not change unless you want it to. What will change is your Medicare and medical assistance will work better together. Additionally, all of your Medicare options will continue, including original Medicare Advantage managed care plans. You do have the option to change your Medicare if you want to, but you don't have to. You might want to have both Medicare and medical assistance in the same plan. If so, you can. Medicare will continue to cover the same things with the same providers as it did before Community Health Choices. Each Community Health Choice plan will also offer a Medicare plan, but you do not have to accept it. You can keep what you have if that's what you want. Regardless of that choice, the approach with Community Health Choices is to better coordinate whatever plans you have. So once again, you do not have to move to a different Medicare plan. The managed care organization will have to work with whatever Medicare plan you have. To make it a bit easier to know what all of this means, here's a list of many of the Medicare plans for the Southwest region of Pennsylvania. You can keep any one of these, and the managed care organization will work with and coordinate with those plans. Okay, that's the presentation for today. Thank you for being part of it. Remember, if you need additional information, you can visit the website below or you can call the number below. Thanks once again.